Hi, I'm Ellen Clement. I've been with public health for many years, but recently made a change from public health to the healthcare sector. I'm now executive director at the Corner Health Center, and believe me, it's an eye-opening change. We were asked to address the question of, can the economic crisis be turned into an opportunity to change our way of life so that a more sustainable way of living is created? And my answer is absolutely. And in fact, I think when it comes to health care, it won't happen without a crisis. And I think we're seeing some of that now. The seriousness with which health care reform is being discussed now is directly related to the seriousness of the economic environment that we're in. If it is to be turned into an opportunity, we really have to make a commitment to health care for all as a right and not a privilege. This is something that is really unique in the United States as compared to most developed countries in the world, which I'm sure all you know. And there's just, to me, no excuse for not having health care accessible to all. We need to control the costs of health care in order to sustain the system and sustain universal coverage. We have to preserve our safety net health care providers. That's the niche I find myself in now. And some of the things we hear about Massachusetts' experience is that they are finding that they, as they cover their entire state population, that they don't have enough health care providers. So we really need to address the things that preserve the entire system of health care providers in order to be able to include everyone in access to primary care. We need to promote preventive health services through policies and incentives, and I'm going to say more about that, as well as creating healthy community environments that encourage healthy eating, active living, and green lifestyles. I think what you're going to see as we all go down the panel is that we're all interconnected, and that's part of what sustainability is all about, is making sure that everything we do addresses our impact on the environment, people's health, people's well-being, in all different ways. Healthcare reform really offers an opportunity to advance health and health equity in our nation, and community prevention can significantly alleviate many of the social and financial costs that we experience unnecessarily by keeping people from getting sick in the first place. 75% of our current healthcare costs are the result of chronic diseases, many of which could be prevented or alleviated in the first place, at a great benefit to people's quality of life and their overall lifetime productivity and satisfaction. Community prevention will help keep people healthy and out of the doctor's office, and that will save us a lot more than money. Estimates indicate that by 2040, our healthcare costs will consume 34% of our gross domestic product. Healthcare reform can really be a major factor in ensuring the future competitiveness of our nation in an economic sense by reducing costs without cutting healthcare benefits or quality. Healthcare reform is not only about saving money, it's about keeping Americans healthier. And we have to really realize that access to health care for everyone is not going to guarantee health for everyone. The factors that create and sustain health are broader, they're community-based, and they have they need a lot more attention than does just the provision of health care, as important as it is, and as essential as it is to our quality of life. 75% of our costs, as I said, are associated with chronic diseases. There are many proven community prevention efforts that can help to contribute to community prevention. Those kinds of efforts focus on improving the physical and social and environment of our community and our nation. When people live in healthy places, they are healthier people. When people have access to jobs, they are healthier people. When people have access to education, they are healthier people. The good news is that we have some efforts working right here in Washtenaw County. Mentioning some of them, Ann Arbor's non-motorized transportation plan is a major effort that over time will dramatically increase people's ability to live active lifestyles. And being able to work exercise into your daily life and your daily routine will probably deliver more to your lifetime health than the doctor's visits you make. There's a effort sponsored by the Ann Arbor Y called Pioneering Healthy Communities. The Y has recognized that there are sectors in our community that have dramatically less access to recreational facilities and physical activity. They have focused their efforts on Ypsilanti because of that, and they're doing many things to bring recreational programs into the communities, to offer safe, supervised ways that children can get physical activity and in environments where they are not at risk of any other kinds of community dangers. I'm going to wrap this up because there's a finger being held up in the back. But I do need to mention in Ypsilanti, bike racks and a major effort to improve the farmers market have greatly enhanced people's access to healthy food in that community. And it is really wonderful to see how much people are interested in improving their intake of fruits and vegetables, and it will also offer lifetime health benefits.